जय श्री कृष्ण चैतन्य प्रभु नित्यानंद श्री अद्वैतानंद शिव श्री गौर भक्तवृंद। हरे कृष्ण 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 हरे हरे, हरे राम 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 हरे हरे। जय श्री कृष्ण चैतन्य प्रभु नित्यानंद श्री अद्वैतानंद शिव श्री गौर भक्तवृंद। जय श्री प्रभुपाद की जय, जय गुरु महाराज की, अक्षर भगवान शनिदेव की जय। Vande Sri Charanarvinda, Vande Sri Charanarvinda, Vande Sri Charanarvinda, Mahaprabhu Dhantam Maitmadan Manasarasena Romanchakam Parshutarangbhajo Vande Guru Sri Charanarvinda Sri Ramadhavaya Madhur Jalila Gunarupona Pratikshana Sadhanada Pasha Pandegara Sri Chara Vindam. Okay. Uh, Basal cell carcinoma. 78-year-old diabetic woman undergoing temporal artery biopsy. She had shoulder pain and tender scalp. When temporal artery biopsy was taken, a skin ulcer was found on the cheek. Describe what you can see. It is pearly papule. Uh, okay. It is Parley papule and Parley papule central ulcer, granulation tissue on the base, and inverted edge surrounding telangiectasia. There is a ulcer central papule, granulation tissue on the base, in inverted edge and surrounding telangiectasia. Differential diagnosis: basal cell carcinoma, squamous cell carcinoma, tuberculosis, actinic keratosis. Natural history of basal cell carcinoma. indolent with low progression. It is indolent with basal cell carcinoma with a low progression, locally destructive, but limited potential to metastasize.
Hello?
Hello,
Yeah,
can you see the screen?
I'm ready for break. Just 5 minutes.
Mm-hmm. Internet with law progression, internet with law progression. What else? FML gives you just to look at the report. What will you look for in the report? We'll look for deep margin involvement, either margin clear or not, and size and invasion. If unclear margin, re-excision with safety margin, with frozen section or most micrographic surgery. If there is lymph node involvement, what to do? Lymph node biopsy, FNC or excisional biopsy. What is frozen section? It is a laboratory procedure that allows the rapid microscopic analysis of a specimen. Advantages of give rapid intraoperative pathological diagnosis. Give rapid intraoperative pathological. Give rapid intraoperative pathological diagnosis. Can you explain the steps? The surgeon takes a sample piece from the tissue or the tumor and send it for the analysis. The pathologist freeze it and section it and immediately cut it. The section will be stained and reported immediately when the result come out. How do malignant cells reach lymph node? Cancer cell, cancer cells, cancer cells, and this secret growth factor lymph node. Malignant cells reach the lymph node. Okay, cancer cells. What are they trying to say? Cancer cells and this secretes growth factors which are taken up by the lymphatic capillaries. Lymphatic capillaries, cancer cells and growth factors which are taken by the lymphatics. I should keep it like this because it is having some. Uh, cancer cells, cancer cells, and these secret growth factors which are taken up by the lymphatic capillaries and transport towards the lymph node. These growth factor induce lymph angiogenesis, therefore promote lymph node metastasis. Also, primary tumor and release primary tumor release immunomodulator. Okay, okay, this is primary tumor release immunomodulator molecules which lead to immunosuppression. Okay. Skin graft were done and the patient had graft failure graft failure subsequently. What are the possible causes of graft failure? Wound infection, hematoma, and rejection. Common organism Staphylococcus aureus, Staphylococcus. What to do to diagnose this? So for culture and sensitivity, blood test, Mm, okay. Oh, what is MRSA? Methicillin-resistant Staphylococcus aureus. What to do if so MRSA is positive? Isolate the patient, inform infection control team, and follow the infection control protocol. Wound debridement, incision and drainage of the abscess. Wound debridement, incision and drainage of the abscess. And give antibiotics according to the trust and local and protocol and microbiology advice. How to decolonize them? Okay. If so, emergency positive isolation. Okay. How to decolonize MRSA in a patient with current patient not infected with a multiple with multiple nasal with mifepristone nasal and chlorhexidine body wash and shampoo with mifepristone nasal and chlorhexidine body shampoo. Who will you involve in the management? Who will you in the ward nurse and microbiologist, infection control team, ward nurse, microbiologist, and infection control team. Patient developed axillary lymph node enlargement. Lymph node biopsy showed large cells uh, with okay. Maybe I can also.